This is the case of gastrointestinal stromal tumor in the wall of the stomach. Here we have the mucosa of the stomach. This is the submucosa. And here we have the well-circumscribed tumor, which typically involves muscularis propria of the stomach. Gastrointestinal stromal tumors are typically composed of uniform spindle cells or epithelioid cells, and it has slightly lobular appearance. This case is composed of epithelioid cells. The presence of the prominent clear intracytoplasmic vacuoles is a prominent feature of the tumor. The cellularity is quite variable. We have areas of hyalinization and the areas where there are more lesional cells. The large number of small capillaries and blood vessels can be seen in some cases. The nuclei are quite uniform, and some of them have inconspicuous nucleoli. Gastrointestinal stromal tumors are typically positive for CD117, which is an immunohistochemical antibody that stains mast cell growth factor receptor. DOG1 is a relatively new immunohistochemical antibody that is also quite useful, but we need to be careful because part of the gastric adenocarcinomas could be positive as well. GISTs are mesenchymal tumors, and they are typically associated with KIT or platelet-derived growth factor A mutations. They can be seen all over the gastrointestinal tract. Most of them are localized in the small intestine, and about 20 to 25% can be found in the stomach. The prognosis is quite variable. These tumors can be benign, borderline, or malignant, and for the prognosis, it is important the localization, the diameter of the tumor, and the mitotic count. Some other gastrointestinal stromal tumors can look like spindle cell, cellular lesions. Some of them resemble leiomyomas. But this is an example of epithelioid morphology in gastrointestinal stromal tumor. Thanks for watching.